And joining us live now is New South Wales paramedic Tess Oxley. Tess, good to see you. Thanks for your time this morning. Just how tough are paramedics doing it?
I think all health workers are doing it so tough at the moment. We're the lowest paid paramedics in the country by a considerable amount. And it's gotten to the point, not where we can't go on a smaller holiday than what we'd like to do, but we're trying to work out how to pay our bills on a daily basis. This is what our conversations are at work now.
So what sort of trims are you having to make?
I'm having to decide on a week-by-week basis which bills are a priority. I'm having to try and work out just how much petrol I need to put in my car by how far I'm driving, whether I'm driving just to work or with a second job if I have to drive a little bit further to get to that job. It's just absolutely every dollar that I spend. I had to try and work out how electricity bills work this week to shop around to try and see if I could find something that might save me, even a couple of dollars here or there. It makes a significant difference at the moment.
Right, so in some cases, are bills going unpaid?
I'm very privileged that I was able to ask my parents for help, but there are definitely bills that we are struggling to pay, that's yes.
And professionally as well, is the job getting harder?
It is. The skills that are demanded of us these days have increased significantly, and that's a great thing, and it's a great thing for the community that we are able to meet the requirements that they need. However, we've not been recognised as paramedics for that, which is why, separate to also fighting for the pay rise this year, we're also fighting for professional recognition.
Oh yeah, but are you feeling any more threatened in the workplace though when it comes to perhaps dealing with dangerous patients or anything of that nature?
I think that you don't always just want to say, well, that's just a part of our job, but that is something that happens. I think generally I feel pretty safe at work. You never know what's going to happen. We're lucky that we have great support from New South Wales police officers as soon as we call. And the majority of the public do respect us and do respect the work that we do every day. But it does have, tough times.
So what will fix it?
I think an immediate pay rise this year that's going to catch up with the cost of inflation. When Telstra can put my bill up by a certain amount, surely the government can consider that my pay should match those rises. Giving things like our salary packaging, letting us receive 100% of that so that those tax incentives that we get for being lower paid health workers, that we actually get to keep that it doesn't go into government bank accounts. These little things actually are the difference at the moment between being able to do a grocery shop and not.
Okay, so just as for the strike today, Tess, what services will not be available? What won't you be doing?
So for paramedics, we'll be changing the way that we offload patients when we arrive at hospital, and they'll only be the low acuity patients. People who require an ambulance, from a 000 perspective, ambulances will not be delayed by HSU action. And then there'll also be action by all our health workers across the hospitals across New South Wales, with things like meal services affected, cleaners changing the areas that they're clean, and certain areas there may be some rolling strikes of health staff. But again, they will make sure that there'll definitely be workers on the floor still.
So worst case scenario, cases, the most urgent, they'll still be treated?
They will absolutely still be treated, and to the utmost.
Just a final one. I mean, we do have a new government. Do they deserve a little latitude in trying to get a deal done?
Look, I'm not a political expert. However, this new government has been in opposition for a long time, and they seem to really be listening to us when they were in opposition, and they knew exactly what the situation was for health workers when they were coming in. So they've kind of had 10 years of latitude. Now we actually just need to be paid.
Tess, we'll leave it there. Appreciate it. We'll talk to you soon.